I'd like to thank the WFH for allowing me to join you here today to present Angry Amy to Shy Suzy, Thoughts on Patient Personalities and Approach. I have no disclosures for this presentation. If I know anything about being a woman with a bleeding disorder, it's that no two of us are alike. There are just as many personalities as there are mutations of bleeding disorders. And if I'm being honest, I think my healthcare team could confirm that over my bleeding disorders journey, I have probably shown more than one of these personalities I'm going to present today in the clinic. Depending on what's going on in my life, how in control I feel of my bleeding disorder, or even if I got a great parking space at the HTC. There's many factors that influence mood, confidence, and identity. I don't envy the challenge that you have in trying to get these different personalities to talk to you and open up about something as personal as bleeding. This morning, I thought I might talk about some of the personalities I'm familiar with and share some thoughts on how to get them to open up and have a fruitful discussion. The first appointment of our Monday morning clinic is Angry Amy. Amy was diagnosed later in her life. Often doctors minimized her symptoms or could not find the source of her bleeding. She may have had untreated bleeds and has most likely been anemic or had an iron deficiency. In general, she could be a pessimist about her health, and due to some bad medical experiences, has had a very low belief that you can help her solve her bleeding episodes. The process of parallel thinking was coined by Edward de Bono. He discovered that groups, when engaged in common thought processes, would be more constructive and have more engagement and positive outcomes than adversarial approaches in debate. Let's think of our conversation with Angry Amy like a traffic light. Angry Amy is the red light, and how can we constructively take her from the red light to the green light? First, we need to join her in a red light discussion, asking her questions like, what are your concerns about this treatment plan? And in taking her input seriously, the group can start in a parallel discussion. Next, we can help Amy to move to more yellow light thinking. Here are some things that I want you to watch for or be cautious of in this treatment plan. This lets her know that you're open to revisions and willing to work with her on the treatment plan, especially if complications arise. Finally, we can hopefully move Amy into green light thoughts. What could success look like on this treatment plan? How would she feel different? How, once her bleeding disorder's under control, would her life and habits be able to change? Encouraging Amy to make some goals of her own may help her to start thinking in successful outcomes. It will be a long road for Amy, but with green light thoughts concluding your appointment, hopefully Amy's follow-ups and future clinic visits will be more positive on the whole, and her outlook about her bleeding disorder might begin to change. Our next appointment is with Mommabear Mona. I hobbled into the emergency room of the Children's Hospital with my 10-week-old daughter, who was exhibiting symptoms of a subdermal hematoma after I had taken a tumble down the stairs with her. She hadn't been diagnosed with a bleeding disorder yet, but from how she bled at her 3-day heel poke, I knew, deep down, I had another bleeder on my hands. Thankfully, she was treated and released the next day. After the guilt and anxiety of how I had tripped, causing my small baby to be injured, had started to wear off almost 2 days later, I began to feel intense pain in my ankle, and I started to realize that it had been an untreated bleed. I had shaken off several attempts by my husband to have it checked out since our fall. Thankfully, it too was easy to treat and healed quite quickly. But it amazed me what I could do and feel, or not feel in this case, when my kids were involved. Mommabear Mona is in deep parenting mode. She worries more about her brood than herself, and will often have one or more of them in tow to her appointment. She'll often shrug off or minimize most attempts at diagnosing her own issues, and rush through her appointment to pick up her kids from school, or get to dance practice. How do we get Mona to talk and, more importantly, focus on herself? Well, what about a little game? Let's tell Mona to imagine that she's won an all-expenses-paid trip for just one to a secluded island. Expert childcare, a chef, and a maid will ensure that her husband has all he needs to help take care of the kids for the week. The only problem? It's the week of her period. We could ask her, what would you bring along to manage your period? If Mona answers, a tub of chocolate mint and a bottle of Chardonnay, I would imagine that she's not having that hard of a time managing her periods. But if she answers 2 boxes of extra absorbent tampons and 6 black pairs of shorts, we can tell there's an issue right away. Once Mona's attention is focused away from her parental duties with a fantasy that she's probably thought of more than once, she may be able to focus and help you understand the issues she's having with her bleeding. Our next appointment is with Doubting Debbie. I believe that von Willebrand's disease often creates a lot of Doubting Debbies. It's a bleeding disorder filled with blurred lines and gray areas. Is this a bleed? Have I bled too much? Is it going to stop soon? Should I go into the emergency room? Is there something that I should call the doctor about? Or am I just being a worrywart? Debbie doubts that her issues are real and has a hard time understanding what symptoms are serious or how to measure them. Often when I'm a doubting Debbie, I need reassurance. Reassurance that talking to my medical team was the right thing to be doing. That it's better to discuss my symptoms with the staff rather than sit at home and doubt. It's reassuring when my nurse uses open postures and turns away from her computer to face me, giving me her full attention. Or when my hematologist encourages me to sit in the chair beside his desk rather than the exam table. Giving me the sense that he has time to talk and discuss rather than a quick poke and prod and send me on my way. These small gestures can make a world of difference when trying to get a doubting Debbie to open up and talk. In marches Factual Fran. On first glance, Factual Fran could be one of your favorite patients. She could tell you exactly how big that bruise is, the exact moment her period stopped and started, exactly how much cyclopropin she took last week, and could probably even give you the exact gene mutation of her disorder, even without a test. Fran has these measurements in the bag. But what Fran does not know is how she feels about her bleeding disorder. She's completely out of touch with her quality of life issues. It is easy for Fran to look at the numbers and measurements, but feelings are much harder. It may be misunderstood how in control Fran is because these numbers seem like she is perfectly in control. What are the dangers for Fran? Depression, anxiety, feeling isolated, withdrawing from family and friends, a loss of sleep, just to name a few. There are real emotional consequences to having a bleeding disorder. So how can we help Fran in the exam room? Since Fran is a numbers girl, we could ask her to rate the last bleeding episode on a scale of 1 to 10, and then relate the numbers to feelings on one of the many charts that are available. This could show Fran that it's okay to feel and relate to her emotions, to her bleeding disorders. That Factual Fran in my life also said that asking direct questions about the management of her bleeding disorder is important too. Questions like, how does it feel when you have to miss work or miss school? Do you have to wear any special clothing when you have your period? What would you like to wear instead? Simple questions can help Fran to open up and begin to become a more feeling Fran. In walks Chatty Cathie. In 1959, Mattel released the Chatty Cathie doll, which when a string was pulled at her back, she would say different phrases. Chatty Cathie was on the market for 6 years and was the second most popular doll in the 1960s after Barbie. That Chatty Cathie was spelled C-A-T-H-Y. Well, the Chatty Cathie in my life is spelled with an I-E. As it is said, Cathie could talk the hind leg off of a donkey. She has an incredible gift for weaving together 6 stories so well that in the midst of the conversation, you've forgotten completely what the first story was about. And the Cathie in your office will often want to talk about anything but her bleeding disorder. She will tell you the story of our husband's cousin's cat ran out in the snow and their neighbor who used to play for the town football team had to have surgery because of a fracture in his... I digress. How can we make Cathie's appointment fruitful and ensure that all issues are discussed in a productive manner? How can we make sure that she is staying on point and the appointment stays off the rabbit trail? One thought is to have a short form that Cathie could fill out in the waiting room. Please list a few of your symptoms, or even what would you like to talk to the doctor about today? Often Chatty Cathies can focus while writing things down and in point form. Once she's transferred into the exam room, a nurse or support staff could write out these symptoms or issues on a whiteboard or easel so that it can be referred to keep the appointment flowing smoothly. Focusing Cathie in these ways can keep her appointment on track, on time, and make sure that we do not lose any important information. Our last appointment of the day is with shy Suzy. She is painfully shy. Perhaps periods or bleeding were never discussed at home. Maybe her mom or female role models did not have a bleeding disorder. She may not even have the correct words to use when describing her flow or a bleed. Suzy can be one of the most difficult of patients to understand exactly what's going on. In my experience, when I am shy or embarrassed about what's going on with my bleeding disorder, it's often easier to talk with the female nurses rather than my male hematologist. Often the first point of contact in the clinic, it's the nurse's job to help Suzy to understand that the clinic room is a safe environment and she can talk about all of her issues. In the past, it's been helpful when the nurse has asked me direct and specific questions about my bleeding to help express these to the doctor. Having the nurse use more professional language to the hematologist in front of Suzy acclimatizes her to words like menses, menorrhagia, clots, or flow. Acting as a mediator can help shy Suzy to feel more relaxed. We can also arm Suzy with tools so that we can help her medical team to comprehend what's going on. Pictured on the left of the screen is me, the Canadian Hemophilia Society's period flow assessment tool. While this tool may not be available in your area, there are many period journaling tools for patients' cell phones. By taking some time and finding an app that would be most helpful in your practice, and then having your patients use it, you have not only given a tool to shy Suzy, but Chatty Cathie or Doubting Debbie as well, who could also benefit. Shy Suzy just has to show you her phone and doesn't have to go into embarrassing details about describing for you the issues. At the end of an exhausting day in your practice dealing with many personalities, I hope that I've expressed that one approach does not fit all. That patients, especially women, are unique in many ways, and that with a little pre-planning and some strategies to get patients to talk, it is possible and will have positive outcomes. Thank you very much.